court. This was suing us on behalf of kids in foster care, alleging that we weren't keeping them safe, that we weren't providing them services that they needed. And so we've been working over the past decade plus to meet these commitments. We renegotiated to 52, but I'm happy to say that we've been making progress, and this is progress that I'm sharing from our period at the end of 2019. We were able to eliminate a backlog of 1,300 CPS investigations. Those are the ones that we do at the beginning, and they were delayed. And so we were able to rapidly get through them and eliminate the delay. Making strides in reducing foster maltreatment in care, we've implemented a strategy that New York City uses, and that is to look at the data in each jurisdiction, examine a case very closely, and let it inform systemic changes. And we've been able to reduce maltreatment in care by taking a real close look at the system level and at case level. We've also demonstrated high performance in caseworker to child monthly contacts. Again, for kids in foster care, it's extremely important that we understand how they're doing and that they're safe. We've also committed to improving our process for handling complaints to our hotline, and I'll talk about that in a minute. We've begun to make more investment in early intervention and prevention, so we can help families before they are at imminent risk of having their child separated and a removal to foster care. And we also have a commitment to children being placed in family-like settings whenever possible. We've been able to demonstrate to the court our efforts to keep kids with their families, and if there is a safety concern, to keep them with relatives whenever possible. And so we have worked with our private agency partners to meet 13 of 52 commitments. By meet them, I mean we can move them in the to be maintained bucket, meaning we've met the level of compliance needed, and oftentimes it's 95% success, and that we can move that and they'll continue to watch it, but it's not something that they're going to actively require us to report out on every month and every quarter. So I don't want to speak too much about that. I can certainly take questions if there's more on that. Next slide, please. So I did want to mention some of our response to the COVID pandemic. We had big goals for child welfare and children's services before COVID hit, and we're trying to still maintain those goals and progress there. But I wanted to let you know some of the things we're doing in response to COVID. We have issued myriad guidance to our staff, probably anywhere from half a dozen to a dozen new guidance to our staff on a weekly basis that helps them stay safe. We've done some virtual, instead of in person, we've done some virtual things. So we've provided guidance on that, guidance on visiting kids in foster care, drug testing, a whole myriad of things that we have addressed through updated guidance. We have had town halls. We've had town halls with our staff in the field. We have 83 counties in Michigan, and so we've had town halls with the administration on a weekly basis so that we can understand what they're experiencing and what families are experiencing and what their needs are. We've met weekly, I believe weekly, with the Supreme Court justices as we've encountered delays with maybe court hearings, or courts are closed, or they're changing procedures, and who they have to be in person to contact, and foster care, how frequently they have to be in person to contact. And we've had to alter those because of the high risk of COVID-19. Our staff is vulnerable, and we don't want to spread COVID-19 by having so much contact that maybe we could do that contact over video conferencing. And so whenever we can do it safely and still meet the needs of the job that we have, we've been moving to video conferencing those contacts. So this just gives you an idea of some of the changes we made. I do want to mention parenting time and sibling visits. Extremely important to our kids and our families in foster care. And so we have tried our hardest to continue in-person parenting time and sibling visits, and doing it as safely as possible. And so we are still doing those. If if all the parties agree, because there's a concern and they all want to do video conferencing instead of in person, we're allowing that as well. But those decisions are made on a case-by-case basis, because we know that parents have a legal right to visit their children, to have that time. And we know that it's important to achieve reunification to keep that contact going. So we've been trying to preserve that. Next slide, please. Just want to briefly mention rapid reunification. When COVID hit, we saw a little bit of a stall in getting our kids home who were almost ready to go home, but maybe there was a court hearing that couldn't be held, or maybe there was a parenting time that couldn't happen. And so those kids weren't going to be discharged to be reunified. And so we undertook a process working with lawyers and courts to identify those kids that were very near reunification and try to get them home and bust those barriers so that we could get them home right away. And so the next slide will show our progress. Total children reunified in 30 to 45 days. We reunified 432 kids, which was 69% of the cases that we identified that were very close and potentially could achieve reunification. Sometimes I think it would have taken some additional months for us to work through some of the barriers that COVID presented. But in working and collaborating with our court partners, our families, and our attorneys, we were able to get those kids home much quicker. Next slide, please. So I wanted to mention transformation that we're doing in child welfare. We are very much trying to rework our system to one that is more proactive than reactive, one that also saw a significant decrease in the calls to the hotline, our child abuse and neglect hotline. And we were obviously concerned about those families and those children and wondered, wow, if we're not seeing those complaints come to the hotline, are these kids and families okay? Are they getting their needs met? So we pulled about 14,000 families that we had more recent contact, but their cases were closed. And we reached out to those families and offered help and assistance and asked them what they needed while everyone was in sort of the stay home, stay safe mode. That was back in April, May. We wanted to make sure that those families had access to all the resources so that they weren't experiencing more stress, that they could feed their children, that they could meet their bills, that they had resources to address even mental health concerns that we were all experiencing. So we reached out to those families and provided referrals, helpful information. We know we had people dispatch shopping for groceries for families. So again, this speaks to our efforts to try to help families in a non-punitive way before they have a crisis. Next slide, please. CPS redesign. And again, this is part of our effort to listen to what families are telling us is helpful to them. Instead of the system coming in and saying that, you know, this is the way we think we can help you. We've been conducting focus groups, listening sessions all through 2020 to hear what families tell us about what would be most helpful to them. And one of the things we've been asking them is about the front end of our system, and that is Children's Protective Services and how we respond to complaints. And so what we're looking to do based upon that feedback is redesign our intake process so that everything is not assigned for a Children's Protective Service investigation, because everything doesn't need one in the same exact way. Sometimes families just need resources and assessments and perhaps some additional assistance. And so we're developing some tools that tell us which families are at high risk and which cases should be investigated by Children's Protective Services and which ones are lower risk, and we may be able to help in a different way. Next slide, please. Briefly, the Family First Prevention Act helps us bring greater federal dollars to the front end of our system and provide evidence-based services to prevent kids from entering foster care. And so we're looking to implement this with the help of legislative appropriations. Our partners in the legislature have been fabulous in meeting this need. We will be implementing additional prevention services in 2021 so that we can keep more kids safe in their own homes. Next slide, please. And I think this is maybe the last slide. And this speaks to the work that we're doing to reform our child caring institutions. I mentioned at the outset, we had a tragic death at one of our residential providers. These are our congregate care facilities, our institutional settings. And tragically, this young man who was 16 died as a result of a restraint. He was being restrained for throwing a piece of food. And so we took a step back and said, this is not safe. And it certainly isn't treatment in a residential setting that's going to help this child move to adulthood successfully and be safe. And so we pretty swiftly issued an emergency order that prevents certain types of dangerous restraints and required reporting of restraints so that we were aware every time a child was restrained and an incident occurred. We have established a steering committee of all sorts of stakeholders to reform the way that we use child caring institutions. Again, our goal is to keep kids in the community, in a family home, and only to access residential services when it's absolutely necessary. So we're working both to keep care safe when kids do need residential services, as safe as possible. And then we're also making efforts to only use residential services when absolutely necessary. Next slide, please. And that is it, Senator Chang. I know
CPS drug testing standards in line with federal guidelines and require independent collection of samples. And so honestly, this is an area where I need to learn more. So I honestly am not familiar with the differences between state and federal guidelines on this. So Stacey, wondering if you have any thoughts on that.
Yeah, I mean, it's an issue that's come up because, the reliability and the validity of our substance use screening tests is so critical to cases in front of the court. They make decisions about whether to return children based upon those results, in part. We make decisions to recommend removal, in part, based upon substance use screening tests. I'll just say that my personal opinion is that we should consider those results, but we really need to look at, regardless of what the screening tests say, what's the parent's capacity to safely care for the child? We can't over rely on the results of a screening test. We need to consider it, but we also need to look at the parent's strengths, what their supports are, both formal and informal. And one thing I'll say and I'm not quite sure what the questioner is asking, but in Michigan, in child welfare, we are raising our testing levels at the beginning of December to comport with the College of American Pathologists standards, which is Michigan child welfare uses a very low testing standard. And so it will detect use rather than abuse or chronic use, and it'll show a positive screen. And that is just not consistent with a lot of what our other partners across the country are doing in terms of their testing levels. And so we're raising those cutoff levels to comport more closely with SAMHSA and some of the accreditation bodies so that we're detecting abuse and where there's real concern, not simple use of substances.
That's great. And that's something that you can do as a department. Is change those guidelines. Okay.
We have a statewide contract, yes. And many of the vendors are already operating, even not within our statewide contract. When we look at vendors across the state are using those higher levels anyway, so.
Okay, question about, there's obviously this ongoing conversation about police accountability. And there's, I think, we have someone asking about a parallel of how can we hold CPS workers and reform there. So wondering about standards for standards for CPS workers and training, what kinds of training, what kinds of social worker who's coming. Let's see. How, there's a question from someone about how would they get another worker, or how would they make a complaint about that worker, or how would they try to, you know, find out if there's a way to get a different person to work with them.
Yeah. Yeah, that's a good question. All of our caseworkers have a supervisor. So that would be the very first place that you would start, and you have every right to do it if you're not satisfied or if something's just not right with the caseworker. To escalate that to the supervisor, don't wait to do that. We'd like to resolve those concerns sooner rather than later. So if you have one, escalate it to the supervisor. And there's a county director of DHHS in every county. And you can even go as high as, the county director. And then of course there are state level folks like myself who can get involved too. Sometimes, Senator Chang, we get concerns coming from legislators about things like that, and we're happy to jump right into those. We never dismiss them. We always take them very seriously. And we work closely with the Ombudsman's office when necessary, which is a separate entity from DHHS that will help us look at concerns and complaints.
Okay, great. Are there, and it sounds like in other states there may be mechanisms to do that.
Yeah,
So,
Michigan doesn't have that mechanism in statute. However, our superintendent of the Michigan Children's Institute, after rights are terminated, children are committed to the Michigan Children's Institute, which is an arm of the department, really. And they are the ones who have the say. They have jurisdiction, and they have the say about placement and about the giving consent to what happens for permanency, who adopts the child. And we have had rare circumstances, although we've had them, where we've placed children back with the parent whose rights were terminated. Circumstances change. We do not want to keep kids in care 2, 3, 4 years after termination. We want them to get to a permanent home as soon as possible. Sometimes that doesn't happen for kids, and they go into residential services, and maybe they experience several placements. And maybe the parent in that interim time has resolved the concern. And so we have in exceptional circumstances, and we're allowed to make a placement with a parent whose rights were terminated. And there's a lot of assessment that happens there before that occurs, but it is possible. So although we don't have a state statute allowing it, our policy does allow it.
okay, did not know that. Question about funding. Why does the department accept funding for everything that children need when they're in out-of-home care, but not in-home care, and make parents pay child support? I think
so the child support rules don't come from the department. So that's not something that we can control. I guess if you have a concern about that, you should address that with a friend of the court. I'm sorry, I can't provide more information about that. I just don't know that system well enough.
Okay.
Yeah, good, valid point though, that the questioner asked. We do spend a whole lot of money after we bring kids into care. That's precisely why we want to transform the system. It does not make sense to separate a child when we can put equal amounts of effort to help that family with substance use services, with mental health services, parenting time, even concrete needs. While we were going through COVID, in order to keep kids safe at home, we offered $1,000 per family as a cap to assist with any of those needs, just because we realized that it makes much more sense to help families in that way rather than experience a crisis and have to remove them and pay $32,000 a year on average for a child to be in foster care.
Okay. Question about issues with Aver Health. I'm assuming that is a company. I'll be honest, I'm not familiar with this. So what do you know about the issues with Aver Health and the state contract and what counties use them?
Yes, it's a state contract. And Senator, this is our statewide contract for drug testing for substance use screening. There have been concerns about AverHealth raised, and some of our courts have now, they lack the confidence in the reliability of those tests. So we are working swiftly, urgently to review and resolve those concerns with our statewide AverHealth contract, because as I said earlier, the reliability of those tests is critical to us. And so we are working with an independent assessment person who's an expert in forensic lab work to independently assess the reliability of the AverHealth testing process. At the same time, the accreditation body is working to do another accreditation study of AverHealth. I will say that a big part of the problem is our low testing levels. And so that's why I told you we're working to raise those by December 1st, which we believe will reduce the errors significantly in those test results. So yes, we have heard the concerns about AverHealth. I'm very familiar with them. We're working urgently to address them. And what we've also made available in the interim, because we recognize that courts who have concerns with AverHealth need to feel confident that they're making the right decisions in a court case. And so we've opened up the ability for any vendor to be used. So if the court has a preference to use a different vendor than the one that the state has a contract with, they can do that much time as we get these concerns resolved. But I will tell you that AverHealth has positive accreditation reports over the past several years. They've been very responsive, and we think that we can overcome the concerns that have been raised.
Okay. We had a couple people ask about what if they think that their caseworker is lying. This sort of goes back to what you were saying earlier, but if they believe their caseworker is lying about what's going on, or just making things up, what are steps that they can take to address that?
Thank you for that. Everyone who has a case in foster care should have their own attorney. So if that question is related to a case that's in foster care or before the court, that always speaking to your attorney is a great strategy. And sometimes you have to call them twice. They're very busy, leave them messages, but please be persistent. That attorney is your person to represent your needs and your interests. They should listen to you, and they should explain things in a way that you can understand and help in your case. And so you can always talk to your attorney. Children have an attorney as well, and that's the person representing the child. And you can always speak to the children's attorney about your concerns too. And again, just back to the caseworker and escalating it up through the department or the agency.
Okay. We had a question about body cameras. Obviously, that's something that has been talked about in the police officer realm, and I've worked on some of that issue as well. But there are a couple folks who had a question about the idea of putting cameras on the caseworkers. Obviously, that's a lot of people, but and there's a lot of. Just curious if that's been contemplated at all, and your thoughts on that.
No, it hasn't been. It hasn't been something that's been contemplated. Our strategy really has been to, again, with the training of our staff, to train staff in a way that helps them understand that families love their children, that they want to do well by their children. They want to keep their families together, and it's our job to help them do that and to keep kids safely with their parents. And so when we take that approach, and when those are our underlying values, that we value families, we value their input, then we can act in ways that are empathetic and compassionate and truly do offer the help to families in a non-punitive way. It's really sad for me to hear about that perspective and experience where there's a desire for body cameras. It's not how we want our staff to operate, where folks feel that they should have a body camera. And so we're doing everything we can to help train our staff so that's not the experience of our families.
Okay. Question about COVID vaccines. Is CPS going to mandate COVID? I don't think there's going to be any COVID-19 vaccine mandates, but the question is CPS going to and there are no vaccines yet being developed for children. So, but is CPS going under the age of 12? Is CPS going to mandate COVID vaccines on children and families, and will refusing a vaccine result in a neglect and abuse case?
No.
All right. And then I know we're almost at 5 o'clock, but let's see. How could a family get a hold of reports from CPS if CPS has been out to a home multiple times within a, certain month period, and the family's cooperated with majority of the workers, and they have all been closed investigations? How could a family get a copy of those reports?
Yep. Yes. And a family has every right to have a copy of that, of what's in their file. And they should make that request to their local DHHS office. The law allows us to release those records. It may take 7 to 10 days to get them released in writing, but you can make that request to the local DHHS office that you want a copy of your Children's Protective Services file.
Okay, great. For all of you those watching, I know that some folks had questions about your specific situation, I would really recommend that you reach out to, your direct contact in your county, depending on where you live. And if I'm your state senator, feel free to reach out to me. If I'm not, we can direct you to yours, or you can look up your state senator at the senate.michigan.gov website and contact your senator directly. And I want to thank you, Stacy, for taking so much time to chat with us today, and to, to stay in touch if there are things that we can do to help in the legislature to continue to improve safety for our children and our families. Would love to be of help. So thank you again. And to everyone who tuned in and asked questions, we appreciate you being here. Thank you.